As you'll see, we help them with all aspects of their health activities throughout the course of a day with a solution that includes both some handheld devices as well as a web portal. Down here is this diagram from a New York Times story recently about a 42-year-old woman with a complex case of diabetes. And if you look at this, her daily regimen includes 36 different doses of medication taken at 14 different times a day. It's just overwhelming. It's easy to understand how she can forget sometimes and make mistakes. But it doesn't even have to be this crazy for things to be overwhelming. Here's another case of a sort of mid-40s man with just sort of an average diabetic. He has diabetes, a little bit of hypertension, a little overweight. And if you look at his daily regimen, it includes, yes, of course, several medications, not an overwhelming amount, just very normal, but he's also trying to stay on top of his biometrics. He's trying to keep an exercise log. He's supposed to be keeping track of his carbs, keep a food journal, and also stay observant to various symptoms and moods that impact his health. Again, just for a normal person, those of us in this room that are trying to run our lives, this is overwhelming. So let me show you how we help, and if we could switch to, okay. So this is a prototype Zume device that has been used by a number of people throughout the course of the year in some beta pilots that we've been running, and including several people at the conference. And this is sort of a prettier design of it that's going to be coming out soon. Basically, it helps day-to-day, hour-to-hour, moment-to-moment with reminders and making it really easy to record your health activities. What I want to show you now is just sort of an iPhone version of this. And Matthew insisted I do this live, and everybody else is doing, on the simulator, so hopefully it will work. But this is going to be available in a public beta in about a month or so. But so here it is. For this person, this is kind of a dashboard. They can quickly look and see what's going on in their health. This is showing kind of a to-do list, and I'm sorry you can't read it all that well, but it says food, water, beclomethasone, zafirlupast, and other such medications. And so as an example, I put water in here to try to remind myself to drink water throughout the course of the day. And so I'm just going to record that I did, in fact, drink my 8 ounces of water as I was supposed to. And all of these medications that I take, I can also look up and see, well, you can't see it on there, but those little spots are when you have taken your medications. You can also enter in food, and I'll just note what I had for lunch. My icon cooperates. And you can even do this by audio, so I'll just speak. Cheese sandwich, potato chips, and a brownie. And so what I've recorded my food journal in here simply as a voice file, which is there now, and it will show up later on the web in a food journal. So if we can switch back to this. I want to show you some real examples of some of our users, but to do it without violating their privacy, I'm just going to show you some screenshots. This is a person with diabetes. She's tracking her exercise, carbs, glucose levels, several medications, and symptoms including cough, sleep disturbance, edema, and so forth. And then finally, to come back to that New York Times example, you might have thought that that medication regimen was just absurd. This is one of our users. That's just her meds. It's even more than the other one. But with our solution, she's been able to stay in control. Thank you.